Well, good morning, everyone, and welcome from the East Coast. We're here in the early afternoon, but welcome to you all. Thank you for coming bright and early to join us for this most recent presentation in a series of sessions from Rutgers. So this one is on utilizing trauma-informed universal precautions during your course of work in supportive housing. And today our primary speaker will be Giovanna Giacobbe, my colleague in our state hospital program and a trauma consultant for the state hospitals of New Jersey. Next slide, please. And myself, my name is Dawn Reinhardt Wood. I may have had some of you in other sessions, so I'm glad to be back with you today. So if you could, just so we can get an understanding of who is in the chat, find your way to the chat pod. So that should be, I believe, at the bottom of your screen. About midway through, you'll see the little chat box. Please let us know your name if it's not obvious in your display name, where you are, and your role, what you do in this line of work. And please feel free to use the chat box as we continue through this session to type any questions, to answer questions, to talk to each other. You know, we love that kind of interaction. You may also raise your hand if you have a question. Next slide, please. So as you know, right now we have everyone muted and cameras are turned off. This is to improve the bandwidth and also so that our presenter is not distracted during the presentation. But if you'd like to ask a question, please open up the chat and you could either type your question there or again, like I said, raise your hand from the participant list and we will get to you. And again, if you have any questions as we go along, feel free to put them in the chat box so you don't lose them. And we will go through them throughout the course of our presentation. When you do use the chat box, please make sure that you are sending your comments to all panelists and attendees. It will usually default to all panelists, but unfortunately then only Giovanna and myself see that. So please make sure that unless you intend the comment for just the two of us, you select all panelists and attendees in that chat box. We are recording today, so the recording is in progress. And at the conclusion of this webinar, what will happen is we will send that cloud recording to Washington and they will distribute the recording to all of you. So you can download it and view it indefinitely. So with all that housekeeping being said, I would like to present my colleague, Giovanna Giacobbe, whose training is primarily in social work. And she is a lecturer in our Department of Psych Rehab. And she has worked extensively on numerous research projects, especially around trauma and its intersection with other serious mental health conditions. And additionally, Giovanna works as a consultant specifically around trauma in our state hospital psychiatric rehabilitation initiative. And she has also co-authored curriculum on assisting individuals who are in an inpatient setting with working through trauma. So with that being said, I'd like to hand that off to Giovanna.
Hi, everyone. Welcome today. I'm glad everybody can make it. So today we are going to be talking about trauma-informed universal precautions. And our learning objectives for the day is to define and explain what trauma really is. Because often folks think of trauma more in like the general sense of either physical abuse, war, or sexual abuse, and it's broader than that. So we'll learn about that today. We're going to learn about ways to prevent its spread through trauma-informed care, and I will explain more in detail about what trauma-informed universal precautions are. So we'll examine the 5 universal precautions, and then we will explore provider coping strategies to prevent burnout, compassion fatigue, and vicarious traumatization. Also, these coping strategies could be used with your clients as well. So let's define what trauma is. When we search the literature, there's really not one specific definition that captures the whole spectrum of trauma and the complexity that goes along with trauma. But APA defines it as trauma is an emotional response to a terrible event like an accident, rape, or natural disaster. Immediately after the event, shock and denial are typical. Longer-term reactions include unpredictable emotions, flashbacks, strained relationships, and even physical symptoms like headaches or nausea. And those reactions could eventually turn into post-traumatic stress disorder. But what I like to say is it's a normal reaction to an abnormal situation. So trauma is a normal reaction to an abnormal situation. So I wanted to further explain what trauma was. And I loved this quote from Dr. Bessel van der Kolk. Trauma comes back as a reaction, not a memory. So any negative experience that threatens a person's sense of safety or interrupts the life that they are used to can be traumatic if the person is unable to effectively cope at that given time. And I wanted to give some negative experiences that can occur in all areas of our lives. So there could be physical experiences, social, occupational, financial, emotional, intellectual. So all of these areas we can experience trauma in. So like, for example, a chronic illness could be traumatic. Losing friendships could be traumatic. Being excluded from social groups could be traumatic. If you think about, in childhood, being excluded at lunchtime or during gym class, not getting picked, could be a trauma that could be carried over into adulthood. Losing a job, being in debt, losing a pet, losing a loved one, not receiving consistent love can be considered traumatic. Also being referred to as crazy, stupid, any kind of experiences that threaten yourself or who you think you are could be considered traumatic. And then these reactions, we often have these emotional responses that come back after the trauma happens. And it's not usually like a memory specifically, but it's this like emotional memory, like an emotional reaction. So what does trauma have to do with me? Like oftentimes people are like, well, I haven't really gone through any traumas, or I'm not familiar with like having traumatic experiences. And oftentimes we all go through traumas, but we don't look at it from a trauma lens. So here are some traumas that most of us have gone through. I mean, all of us are currently going through a trauma, which is the pandemic. But then these are often other ones that we usually experience in our lifetime. So like death of a loved one, a car accident, natural disasters, terrorism, domestic violence, community violence, loss of a job, or loss of income, divorce, even separation, illnesses, especially chronic illnesses, could be considered traumatic. So trauma really has to do with the experience, not the event. So trauma is not really defined by the event, but it's defined by the experience, like how you view yourself and the world after going through the traumatic experience. Also, lack of food or shelter can be considered traumatic. Here are other more common experiences or events that could be traumatizing, but we also don't see as traumatic. So being discriminated most definitely can be considered traumatic. Being bullied, ridiculed, belittled, being called hurtful names, being disrespected or feeling disregarded, being shamed or humiliated, a lack of love or attention, especially in childhood, could carry over into adulthood. Embarrassing situations, not being heard or understood, witnessing others suffer a traumatic event can also be considered traumatic. Any of you can think of ones that you would like to add to this list? Is there anything you can add? So not just this list, but let's see if I can go back. So out of all the ones that we just spoke about, is there anything that I didn't capture that you would consider traumatic? Even this list back here. Anything I didn't capture that you would be considered like traumatic? And you can put it in the chat. So
I see folks are saying some of the things that you had on the list here. So being bullied, divorce, loss of family or parents, generations, and Leah just said generations or historical trauma.
Yes.
So, yes. So I know that war. So even if not in this generation, right? Historically, great name calling, great. Yes. So I know, Giovanna, this is something that you have incorporated into some of our screenings even, has been trauma surrounding interactions with the police. I don't know if you can speak to that at all.
Yes, definitely. So police brutality is one. And so the patients that I've worked at the state hospitals is the ones that brought it up to me about their interactions with police and how traumatic it's been, and how as a society, we haven't really addressed it or properly talked about it, especially even in mental health, we have not. So yes, interactions with police are definitely considered traumatic.
I have one. How about, Cameron just basically touched on mine. I was going to say the experience of homelessness.
Yes, definitely. That's another one that was brought up to me by the patients at our state psychiatric hospitals. A lot of them have gone through homelessness, and on the screening forms that we've provided them, homelessness was not on the screening form. And they said, well, what about homelessness? Like, that's extremely traumatic. And it was a trauma that many of them have gone through. So yes, homelessness. Anything else you guys want to add for traumas? So again, I just want to restate that trauma is not about the experience, but your reaction to the experience, how you're feeling overwhelmed, how it's changed the sense of who you are, the way you see the world. That's where the trauma is. Oftentimes people think of trauma as an event. And that's why we always hear about it as like war or rape or physical abuse. But it's so many other things, and it's not being properly captured, especially by mental health professionals. Like, we're not seeing the traumas because we're not aware of what trauma is. Anything else, Dawn, before I move on?
No, I think we've captured it. People are referring to a lot of medical emergencies, access to actual services such as mental health services and restrictions. Yes.
Yeah, not having access to these things could be traumatic as well. It gives you that helpless or hopeless feeling. So why is trauma often ignored? I want to throw that question out to you, and then I can go over why I think some of it is ignored. But why do you guys think that trauma is often ignored, especially by mental health professionals? Like, why are we ignoring it?
So folks are saying we don't want to acknowledge it. We may not know how to acknowledge it. The stigma surrounding it.
Yes.
It may not be seeing physical manifestations. Additionally, some professionals might think it's an excuse.
An excuse?
Yeah. Yes. Or this feeling of, I got through it, why can't you get through it? So again, this idea that, it's the event, not the experience, and how we react to it.
I hear that one often, that like, well, I got through it. Why aren't you getting it?
I had a rough childhood. My parents hit me. Why can't you get over it? Right. Looking at people as being attention seeking, or as Linda said, the trauma might hit really close to our own trauma.
Yes, that's another one. And that's one of my hypotheses, is because trauma is such a universal experience that if we don't deal with our own traumas, we don't feel capable of being able to handle it in our clients' lives. And often, it's like we push it onto the other professional. What usually happens that I've seen in the field is, so I've worked in both outpatient and inpatient. And in outpatient, we would go to the outpatients and talk about like trauma treatments and trauma services and trauma screenings. And they would often tell me, oh no, like that's not our job. Like that needs to be done on the inpatient level. Like it's too much for us. Our patients, they need more specialized services and like more intense services if we're going to do it in outpatient. So then I finally go to inpatient, and the inpatients say, oh, no. Our patients are too dysregulated. They have to be done on outpatients. And my mind was blown. I was like, okay, so who is going to handle this? If we keep throwing it to each other, like inpatients and outpatients, they can't agree. And what I say is we both need to address it. Outpatients and inpatients need to address it, but it's being ignored. Go ahead, Dawn.
Sorry, we lost you, Giovanna, like the last.
Oh, goodness. I can't hear you either.
It may have been me. It's okay. Carry on.
No, I couldn't hear you either. You guys lost me? Can you hear me?
Yes, we hear you.
Okay, good. So did you hear the part about my experience with the outpatients and inpatients?
Yes, they all heard you. I think it was me, Giovanna.
Oh, okay, good. Oh, I got scared. Okay, so why is trauma often ignored? Was there any more comments on as to why they think it's often ignored?
Yes.
Do you want to read some more? Because I can't hear you.
Oh, sorry. Can everyone hear me?
Now I could.
Okay, all right. So the folks are saying also it makes people uncomfortable, that there seems to be no such thing as trauma-informed first-person care. And Robert says maybe folks are just trying not to re-traumatize.
Interesting.
Yep. So that's what we've got in the chat.
Yeah, oftentimes we think that if we bring up their trauma, we're going to re-traumatize them. In the literature, when you read it, it really is, it goes against that thought. Oftentimes they're relieved to be able to have someone acknowledge their traumas because they're carrying it with them. It's not, when you ask them if they've gone through a traumatic experience and you give them like a list of traumatic experiences, you're not like putting anything into them. It's already there. They live with it every single day. So asking them is not going to re-traumatize them. And there's literature to support that. Often we re-traumatize them when we don't ask them about their traumas, and then we don't know, or we can't like make assumptions based on their traumas of like, well, my interaction, I might be able to adapt it if I know that a patient has been belittled, or if a patient has been homeless, like how do I help that client work through certain things that might be connected to the homelessness. So by asking, we get a lot of information, and we can make certain assumptions and take precautions to not re-traumatize them based on certain things that we know, and then talking to them about, safety and what makes them feel safe when working with a provider. But if we don't open up that dialogue, then oftentimes we inadvertently re-traumatize them anyway. So here's some points that I thought were reasons why trauma is often ignored. In many cases, the traumatized person does not realize that they were traumatized, or it was painful to recall. So they don't bring it up to the provider because they don't know that they were traumatized. In addition, it might be shameful or difficult to talk about the unpleasant events of their past that they have endured. So they feel like they shouldn't bring it up to you. So they won't bring it up if you don't ask. Many people don't realize that their current reactions, feelings, thoughts, or behaviors might be related to past traumas. So again, our clients really don't make those connections, that their current symptoms, their current thoughts, their current behaviors, it might be stemming from past traumas. And then on top of that, professionals fail to make those connections to their trauma histories. And I love this quote from Peter Levine: "Trauma is perhaps the most avoided, ignored, belittled, denied, misunderstood, and untreated cause of human suffering." And he's one of the experts in the field. Him and Dr. Bessel van der Kolk are great. They have a few books out there that I highly recommend. And you will get a copy of these slides as well. So let's talk about what is re-traumatization. So it's reliving stress reactions experienced as a result of a traumatic event when faced with a new or similar incident. It can be created by a situation, an attitude, an interaction, or environment that replicates the event or dynamics of the original traumatic event. It can trigger overwhelming feelings and also lead to aggressive reactions. So oftentimes, what I always teach my students is that aggression or anger is usually associated with not feeling safe. I always make that assumption when I see someone acting aggressively or really angry. It's usually because that person is not feeling safe, either physically, emotionally not safe. Someone, they feel someone disrespected them. That's still feeling unsafe. Their needs are not being met. That's still feeling unsafe. And then re-traumatization is often unintentional by others, but it still can be devastating. So oftentimes when a person is re-traumatized, like we often, it wasn't intentional by us. But if we don't know what the person's traumas are, we can't take the necessary precautions to avoid re-traumatization. So what is trauma-informed care? So it's an approach adopted by an organization that recognizes that both staff and patients have gone through traumatic events and take this into consideration in all interactions. I saw someone's hand up.
Sorry, that was mine. I was going to see if you could go back really quick to the previous slide.
Sure.
Okay, thank you.
Did you have a question?
No, I just wanted to review it really quickly again. Thank you.
Okay.
Okay, thank you.
Sorry about the little barks. That's my little dog. She heard someone outside. So defining what is trauma-informed care. It also acknowledges the need to understand the patient's life experiences in order to deliver the best level of care. And it strives to prevent trauma and or re-traumatization from occurring during interactions with service providers. And there's 6 guiding principles to trauma-informed care. And that's safety, trustworthiness and transparency, incorporating peer support, collaboration and mutuality between service providers and clients, having clients have empowerment, voice, and choice over the services that are provided to them, and then taking into account cultural, historical, and gender issues. So that's trauma-informed care. So I wanted to give some examples of like what trauma-informed care would look like as opposed to not providing trauma-informed care when you're working with clients. So not being trauma-informed would be like if a person had a reaction and you're like, what is wrong with this person? Being in trauma-informed would have the perspective of saying, what has happened to this person to make them react like this? Either in the current moment, what's happening, or what's happened in their past that they're acting like this, instead of saying, what's wrong with this person? Not being trauma-informed is also saying that the clients are attention-seeking, or they're manipulative, or they're ill-willed. We often hear that from certain clients. And instead, being trauma-informed is having that perspective that people in our care may act out of feelings of hurt, fear, or being unheard. So like really taking into account like, instead of just, assuming, oh, that person's attention seeking or that person is being manipulative. Like really understanding, well, where is this behavior coming from? Like the underlying source of it. Or are they really just feeling like unsafe? Another one is clients can change and stop destructive behavior if they only put their mind and will into it. And being trauma-informed is more like people in our care need support, trust, and safety to make behavioral changes and heal. Again, that one is like more like about being manipulative, like they can change if they wanted to. They're not strong enough, or they're attention seeking and they're being manipulative right now. And it really is about your perspective on how you want to view that client of yours. And then staff need to control clients and manage them. I've heard this a lot, especially in the psychiatric hospitals, that we're here to control them and to manage them. But instead, it should be more like people in our care are treated for their disorders collaboratively while minimizing re-traumatization. So we're working together with them. We shouldn't be controlling them. We shouldn't be managing them, but we should be collaboratively working together to help treat them. That collaborative approach which is really important in trauma-informed care. And this is what our topic and presentation title is about. What are trauma-informed universal precautions? And let me give you a little background as to how they came to be, because it's not in the literature. It's something I helped to develop with the state psychiatric hospitals in New Jersey. So the assistant commissioner assigned a task to this trauma-informed committee that I'm on. And he said, you know, there's medical universal precautions, you know, like washing your hands, wearing a mask, you know, when you wash your hands, you know, you're supposed to wash it, you know, 20 to 30 seconds, maybe while singing happy birthday or something like that. So he said, you know, he's like, is there anything that you as a committee can come up with that could be universal precautions to prevent re-traumatization or to prevent trauma from happening at the state psychiatric hospitals? And he's like, can you come up with like 4 or 5 that, you know, people can easily remember and utilize that could change how we deliver services to our patients? And so over the period of several months, we discussed like what are some basic universal precautions that would be helpful for the patients at the hospitals. And so this is how they came to be. And what they do is they can prevent trauma from occurring. They can prevent re-traumatization. They can create a safe environment for both staff and clients. They can help create a healing environment for the people we serve. And they should be applied in every situation and every interaction with both clients and staff. And so we're going to jump into them. So there's 5, and we will watch a video on them. Actually, me and Dawn are both in this video. And the video will give, I think there's 3 scenarios in the video. So as we're watching them, I will stop it after the scenario occurs and we will have discussions. Some of them will be polling, and then some of them will be like open-ended questions, just to really try to dive into these universal precautions. And there's a fun song in the beginning that kind of helps you to remember the universal precautions. So the first one is use therapeutic communication. The second one is no room for judgments. The third one is create a healing environment. The fourth one is to practice self-care. We are going to talk more about that after these universal precautions. That's what we're really going to dive into today after the video. And then we should always consider and address pervasive crises. And the one that we're dealing with right now is COVID-19. Also, police brutality we're currently dealing with, and racism. So there are certain pervasive crises right now that are going on that we've been trying to deal with as a society. But yes, these are the 5 universal precautions, and we'll jump into the video, and then I will stop the video. We will come back and, you know, have some discussions around the scenarios within the video. Does anybody have any questions for me before we jump into the video?
I would just like to jump in, Giovanna, and tell the room that I am not as mean as I appear in this video. Thank you.
Yes, Dawn was kind enough to be the staff member that was breaking the universal precautions. So Dawn, we thank you, and yeah, please don't think that Dawn is the complete opposite of the person that she is in the video. So thank you, Dawn, again for doing that video with me. You really helped me.
My pleasure.
We also did this video during COVID, so it was really hard finding people.
And it was 100 degrees.
Yes, yes, yes. It was over the summer we just did this video. Let me know if you can't hear it. I'm gonna make sure I'm up.
Trauma-informed universal precautions. Trauma-informed universal precautions. Trauma-informed universal precautions. Remember these five so we can all thrive. Use therapeutic communication. No room for judgments on anyone. Create a healing environment. Consider and address pervasive crisis and practice self-care. Don't forget your self-care.
Yeah, man. Oh,
Davis, come on, time to go to group. We're gonna be late again.
okay.
Come on, guys.
I'll be there in a minute.
Come on, Davis. I said now. Let's go. We can't sit here all day.
I'm in the middle of a game. She has no respect for me. I mean, who treats anybody like that? Especially an adult. She treats me like a child.
Oh, come on. I said now. Come on, you guys. Let's go. Ugh, he's so manic. I just wish he would come to group. I just want him to get better. I'm tired of begging the patients to do things. I'm so tired and I just want to get through this day.
No vale la pena.
I didn't understand you. Could you repeat that?
I said it's not worth fighting over.
Well, we need to go to group. Come on.
Oh, goodness, Dirk.
Okay, so I wanted to ask a few questions regarding the video. Where is my polling? Okay, so this is not polls, but these are some questions I wanted to ask in regard to the video. Can everybody see the poll questions? Or do I have to launch it? How does this work?
You have to launch it. We can't see it yet.
So I have to put all panelists to vote, I guess?
I guess so. I've never done polls.
Did everybody put themselves as a panelist? John, what was it that they had to put themselves as?
No, they are all attendees.
Okay. Do they have to change themselves to panelists in order?
I don't believe so.
Okay. So this is not, you don't have to vote for this, but at least you can see the questions and then answer the questions in the chat. So let's do the first one. What do you see went wrong with the staff member's approach? So what in her approach, what do you see went wrong?
Folks,
go ahead.
Folks are saying things in the chat like she was very urgent, rushing the clients. Clapping at him could make him feel lesser than. Being inconsiderate, talking to him as a child or treating him like a child. Another seconded the clapping the hands. Thank you for noticing that. I told Giovanna I was channeling all my bad mom moves. Very authoritative right off the bat.
Yes.
Demeaning language, a third for the clapping. That I was aggressive in my approach. Tone of voice, loud noises, which could be triggering.
Tone of voice. Yes, I'm so glad someone brought up tone of voice.
Yes. And the fact that I simply didn't ask. I just told them that they had to go. Thank you. So I didn't even the feeling that they had options. Interrupting and not greeting the other person, not treating that other person with dignity or respect. And reinforcing white supremacy by saying, I can't understand you.
Oh, thank you. Thank you. They picked
Isn't that wonderful? Because we talked about that when we filmed it. I was either going to tell her, could you speak English or something like that? So I'm glad you picked up on that, Bridget. Thank you.
Yes.
So and excellent.
And it was like disapproval, right? Like the way she asked, she's like, I didn't understand. Like, and her face and everything was like disapproving. Like, you should be speaking English.
Yes.
Good one. Good one.
Excellent comments all.
Let's see if there's anything else I wanted to. So you guys got the subtle stuff also. How could she have been more supportive and still encourage them to get to group?
So folks, so Sarah Lynn says, give them an option or perhaps a timeline. So probably like, can you do this in 5 minutes or something? Asking rather than telling is what another individual said.
Yeah, especially they're adults.
I could have showed up earlier, sat with them, and then given them a timeline.
Yeah.
Ask, offer support to them rather than give them an ultimatum, like help them get to group maybe. Get on their level. Absolutely. That's something I will kneel usually when I come up to people and try to engage them in something or get, kind of squat. So getting on their level instead of standing over them, Robert said.
Or even like sitting next to them, right?
Absolutely. Erin said to let them know that the group was starting and that I would love if they would join me.
I like that approach.
Yeah. Explaining my perspective. So why I'm making this demand, not interrupting their game, let them take time to take the initiative to recognize my presence in the room. Framing coming to programming is more of a good, exciting thing, enticing them. Another person said to physically move myself to their level, so I'm not talking over them, and using a calmer tone. Jody suggests eye contact. And explaining the plan and giving them options rather than springing it on them.
Those are all great suggestions. I also like, you guys brought it up several times about her like standing over them, like overtly standing over them. Those are like subtle things that we take for granted, but can be threatening to our clients. And what sorts of things challenge you with the clients you serve? And having challenges is normal, right? Like it's a normal experience. We all have challenging experiences with our clients. So I was just trying to normalize that and see if anybody has any kinds of things that challenge you specifically. Pamela is raising her hand, Dawn.
Pamela, you may speak.
Is there something we have to do to make her speak?
I allowed her mic.
Okay.
I think it might be an accident, maybe.
Oh.
You there, Pamela? Well, okay, we can move on.
Okay. Anybody put anything in the chat about any sorts of things that are challenging with your clients?
Well, folks are saying that some individuals could need a lot of attention.
Okay.
Maybe they're not attending to meetings and other interactions with staff that they're supposed to be. They're the client's own kind of background and history, housing barriers or housing background that they're bringing, which makes the job of the staff much more difficult. Being able to set healthy boundaries for themselves. So for the staff, for themselves.
Oh, we're going to talk about
with
that.
A client in crisis.
Yeah, we'll talk about
and also sometimes not having similar life circumstances, which we're trying to normalize with the individual, but we may not have shared them themselves, shared in the situation ourselves. And folks are saying, some folks may be quicker to anger, and this could bring up our own personal trauma. So, and not trusting Caucasian folks because of intergenerational trauma.
Of course, definitely. Someone brought up avoidance, like avoiding going to group, avoiding coming to program. That is a trauma symptom. Avoidance is a big trauma symptom. So I like to always view their behaviors through like a trauma-informed lens as to like what might be underlying this behavior.
I wanted to mention one more thing that Jody mentioned in the chat, and that was the client simply may not be ready. So when we think about stages of change also, they may not be in the stage where we are, right? So sometimes it could be a mismatch. We're ready for the person to transition out of homelessness and to accept that great apartment that we found for them, but they may not be ready for a number of reasons. So
very true. Yes.
Great comments, everyone. Thank you.
Yeah. Okay. Let's see if we can jump back into this video.
Yeah, I really want to help, but where do we start? How can we help them?
This is why we need trauma-informed care universal precautions.
Oh, you mean like when doctors are required to wear gloves when taking blood, masks and gowns in surgery rooms, stuff like that?
Exactly like that, except in this case, we're trying to avoid the triggers associated with trauma and to avoid the spread of trauma.
Oh, I see. That makes sense. It was really very much needed for both its clients and the staff as well. Can you tell me a little bit more about these universal precautions?
Yes, of course. So there are 5 universal precautions that can help prevent situations like this from happening. The first one is pervasive crises. This means we're all going through difficult times in our lives, and we need to acknowledge this. We should assume everyone has gone through some kind of trauma in their life and keep this in mind when interacting with each other.
You're right. When Lynn started yelling at John, she really wasn't considering past traumatic experiences John may have had that involved loud yelling.
Yes, that's exactly what I mean. And Lynn has probably gone through her own traumas as well. But as staff, we need to be responsible for our own reactions.
Yeah, that's actually super important to point out. Staff are also struggling with their own traumas.
Exactly. So let's move on to the second one. The second universal precaution is to use therapeutic communication. This means that we approach the client in a caring and non-judgmental way so that they feel safe and understood. We must always look at how we approach the client. We should do it in a respectful way and be aware of our tone of voice, eye contact, body language, because they may be making the client feel unsafe. We also want to listen compassionately to the client and allow for them to have a voice and choice over their life.
Yeah, I didn't really see Lynn do that when she aggressively interrupted their game and called Gerald by his last name. She almost sounded like a drill sergeant.
I completely agree on that one. So let's move on to the third universal precaution. This is no room for judgments, meaning we should respect culture, gender, race, ethnicity, and sexual orientation. We should also never judge a client for their behavior or have their mental health diagnosis overshadow the person that they are.
I totally agree. It kind of offended me when Lynn said, "He's so manic," to describe the way Gerald was acting. I don't really like it when staff generalize people by their symptoms and disorders. He was just excited about the outcome of the game, but she didn't really take time to read the situation, so it came across as judgmental.
Exactly. I completely agree with that one. We shouldn't be too quick to judge all behaviors as part of their mental health diagnosis. This leads me to the fourth universal precaution, which is to create a healing environment. We should create an environment where a client can flourish. Now, imagine clients who are struggling and come to a place where we are supposed to be helping them. Yet the environment is doing the complete opposite.
Yeah, the whole interaction between staff and clients felt off there. It didn't feel like a supportive place at all. It felt combative. It's got to be hard to recover in an environment like that.
That's exactly what I was thinking. Lastly, we must all practice self-care. In order to do this challenging work, we must take care of ourselves first. We also must be aware of our own triggers and traumas and know how they might be affecting our work. Also, it helps to take a break before you reach that breaking point. And don't be afraid to reach out for support from your colleagues.
Yeah, Lynn didn't take lunch, if you noticed. I wonder if that had anything to do with her irritable mood.
Maybe it did. This scenario, it gave us a number of examples of what not to do when supporting people in a trauma-informed way. Let's see if they can fix this using the trauma-informed care universal precautions.
Hey, John and Michelle, looks like you're having fun.
Yeah.
Only by a little bit.
Oh, I'm really sorry to spoil the fun, but are you guys at a point where maybe you could stop and pick up the game later on when we have some free time? Because group's coming up in a few minutes.
They don't want to go to group. I guess we can pick up the game later.
Yeah. Sounds fun.
All right.
Yeah, come on, maybe that's going to teach me later. I don't know how to play anything.
So Derek, what do you think about that one?
I really like this time how she approached them and acknowledged the fun they were having.
I couldn't agree more. She really validated their experience.
Yeah. Let's take a look at another scenario now. I wonder if they'll follow the universal precautions this time.
Oh, God, I didn't get my coffee today. Thinking about all the stuff on my plate at home, my kids homeschooling. I have an elderly parent. I don't know if I can face this day.
I'm so worried about my mom. I can't even call her when I want to. I've been up all night worrying. I don't know what to do anymore. Can I use your phone? I need to check on my mom.
I just got in the door, Michelle, and you're already asking me for stuff? Really, the world doesn't revolve around you.
Nobody cares about me here.
I'll be back.
Giovanna and Derek, we really need your help. The atmosphere needs to change around here.
Okay, let's see. Let's go to scenario 2. So my first question to you guys in reference to this scenario is, how does our personal stress interfere with providing care to our clients? How do you think personal stress interferes with providing care to our clients? Because we saw that Lynn had a lot of stress going on before she entered the door.
So folks are saying things like much less patience, being distant, empathy is tapped out, distracted because I guess she's focusing on other stuff. Less patience, already possibly in a flight or fight flight status. Excellent, Jasmine.
Yes.
Because you know what? I probably was feeling that way that day because all those things are true. Homeschooling and elderly parenting. And so Lisa, so Jody said insensitive. And I think, you know, feeding right into Lisa's comment, it could desensitize us to the struggles of folks around us.
Yes, yes, especially desensitize us.
Yes, great. Irritable can make us irritable, Monica says. Great, wonderful observations, folks.
Yeah. What are your pre-work rituals? They could be either, you can bring up pre-COVID pre-work rituals, because I know some of us are working from home now. So my pre-work rituals have changed, because usually my pre-work rituals going to work, driving was different than now working from home. So pre-work rituals, either pre-COVID or now, or what are some ideas that would feel right for you to put you in the right mind frame to get ready to positively interact with clients? So like, what kinds of things could you do to get yourself ready? So for me, my pre-work ritual was like listening to playlists on my drive to work. And then I would always stop off for coffee. So those were like things that like helped me to like focus and put me in a mind frame that I felt like better with interacting with both staff and clients. And I know that it definitely helped, because there were times that like on the drive to work, I would have like phone calls, and those phone calls actually interrupted my playlist, and it did put me in a different mind frame than when I would listen to my playlist.
So Giovanna, some folks are saying similar things to what you do. Music, breathing or grounding exercises, listening to podcasts. That's something that I know I do. Journaling, writing down our own troubles, acknowledging them, but leaving them at home so as not to bring them to work. That's an excellent suggestion.
Yeah,
getting it out of our head and onto paper. That's great. Now, so Haley says now that she's working from home, listening to morning podcasts and eat breakfast. Monica says eat, so she seconds eating.
Yeah, eating.
Yeah, we all second eating. That eating is a good thing. Haley also says walking her dog for at least 10 minutes.
That's a good one.
We have more folks listening to podcasts, radio, music, having coffee, drinking lots of water. And I like this, wearing a fun outfit. So even now, when we may not be leaving the house so much, or we may, but we have to be covered up. I know one of the things I like to do is to buy fun masks to wear over my surgical mask, because I'm double masking it these days, but it could still be fun, right? Coming in early and actually making the coffee. That's awesome. I like that.
That is awesome.
You're not only doing something good for yourself, you're kind of giving back to the coworkers. Let's see, doing yoga before.
Oh, I like that.
Or a warm cup of coffee and kitty snuggle time. Putting positive notes on your desk for yourself, things like it's going to be a great day. Positive affirmations, thoughts, and prayer or meditation. So some great suggestions. Thanks. Everyone.
And the other one is, how do you decompress at the end of your day so you don't bring your work stress home with you? Should have said with you.
So I do want to add here that Cameron said a daily check-in with coworkers, which is interesting because it's kind of something that we do. Well, we do it 3 times a week. We have kind of like a formal meeting check-in, but yeah, just reaching out to your coworkers and finding out how they're doing. I love this. Jasmine says, take a longer path home. So at the end of the day, especially if you've had a difficult day, taking a different route home that might take you longer, or maybe you need to stop off somewhere to help with it. Transition.
Oh my goodness, that is so true. There's been a couple of times that because of traffic, I usually took a highway home, that I took like the side roads, and I went through, like there was cows and horses, and I was like, oh wow, why don't I ever take this road home? It was like so soothing rather than being on the highway. So yeah, I like that idea to intentionally do that.
So I see a couple people talking about, this struggle of working from home and then being able to transition into the more of your home life or personal life at the end of the day. So I see Rebecca says she separates her workstation away from home. So separate workstation from work while she's working at home than the rest of the house. Recommend taking part in, let's see here, I'm moving, mutual aid and solidarity efforts. That's wonderful. So kind of that social connection. I'm sorry if I pronounce your name wrong. I apologize. Please correct me. Lakin. It's a beautiful name, but I know I'm butchering it. Working from home, so they put all of their work things away and do some yoga. I do something similar. I'll take a shower or a bath or something when I'm done work, just to make that transition.
Yes, definitely.
Judge Judy. Some folks say they watch Judge Judy. Okay.
I usually take my dog for a walk. Not recently because of all the snow. So I'm missing that. But yeah, usually at the end of the day, taking my dog for a walk is a nice way to get some fresh air. And
so yeah, people are talking about a lot of like exercise, movement, connecting with their furry children, music, and a lot of these kind of like transitional rituals that folks seem to have right now. That's great.
Yeah.
Thank you guys.
Yes. All right. Let's get back into this.
We got you, Michelle. There, don't we?
We do.
I realize these are challenging times and we're all on edge. We need to be aware of what we're bringing into our work environment and how it may affect our clients.
Yeah, it's understandable for Lynn to be stressed with what she's got going on in her life, but that doesn't give her the right to treat Michelle like that. She was just plain rude.
Yeah. I felt like Lynn before, and it's been hard, but what's worked for me is working on my own self-awareness and checking in to see how I'm feeling and what I need before I start my workday.
Chocolate, maybe?
Chocolate always helps make any problem a bit better. That actually sounds yummy. But I was thinking we need a little more than chocolate for this situation. Like have time set aside for pre-work rituals, a favorite music playlist on the ride into work, maybe a couple of minutes of a breathing exercise in your car right before you walk into the office, a coffee run to your favorite coffee place. There are many things you can do for yourself to get you in the right mind frame to have meaningful interactions with your clients and your colleagues.
Works for me. Let's see what happens this time when we take time to consider the trauma-informed care universal precautions.
I've got a lot on my plate. I have to acknowledge that. But I got to take care of myself before I come in here in the morning. So self-care is really important.
Michelle, how are you doing today?
I'm okay. I'm just very worried about my mom. She's been really sick and I just want to check on her. You think I could use your phone to make a phone call?
Okay, well, I just got in the door. It's like, let's see, where's my phone? Oh, 9:10 now. Can you give me like just a few minutes to put my stuff down? Maybe come back to my office in about 5 minutes, so like 9:15-ish, and I'll help you call your mom.
Thank you so much. I appreciate it.
Thank you for being patient.
Of course.
I like this outcome much better than the last.
Me too. I like how even though she has a lot of stressors going on in her life, she took a few moments to acknowledge them and sit down with some breathing exercises before she stepped foot in the door.
Yes, definitely. Well done, Lynn. Okay, I think we have time for one more.
Finally take my lunch. Hi, this is Lynn.
Hey, Lynn, I need you to work on this treatment plan like as soon as possible.
I was just about to take my lunch. I mean, okay, I'll just take lunch later. Bye. I finally have my lunch.
Did someone set up the television so we can play?
Oh my God, I'm so hungry and now I can't get my lunch again. I told you about the screaming. It's completely disrespectful. If you don't stop yelling about the game, you're not going to be playing any games whatsoever.
Why does she treat me like a child?
I really need to talk to the psychiatrist about him. He's acting so psychotic right now. There goes my lunch. I guess I'll just pick up fast food on the way home again. I really could use a cigarette.
Okay, wow.
Okay, last scenario. So we have some questions. And this one is a poll question. So the first one, number one, is a poll question. I'm gonna launch this poll. So the first poll question is, have you skipped a meal at work because you were too busy? Can you guys all answer the poll? I'm getting, Dawn, is it working?
I'm not sure what's happening with the poll.
Oh, wait, it is. It's working. It's working.
Okay.
Are you able to access the poll, Dawn?
No, only the attendees seem to be.
Oh, okay.
Yeah.
Okay. So if you want to, while we're waiting for this part of the poll to be answered, you can also, in the chat, what about your job makes you skip meals and or breaks? In the chat, you can put that one.
And I just want to say it's probably a little confusing for folks because it looks like we have poll questions mixed in with the open-ended questions. That's, guys, just so you know, we're not able to load our poll and open-ended questions in ourselves. So we relied on someone else to do it, and it's a little clunky right now. So you can just answer the ones that have the yes or no closed-ended responses to them, and then we'll get to the others. Thanks for pointing that out, guys.
Yeah. So the NAs are open-ended questions.
And folks are saying that some of the reasons why they're skipping lunch or breaks is things like crises, understaffing, just large overall workload. Mark says sometimes he just forgets or is too busy. Sarah Lynn also said she gets so busy, then looks at the clock and realizes she was supposed to take the lunch 30 minutes ago. So again, and Monica is saying poor time management. Sounds like a lot of that, like a lot of us get caught up and then the day gets away from us.
Yeah.
Yeah, so I'm seeing a lot of that. So it looks like most of us are helping other folks and then setting our own needs aside. Hannah says sometimes she prefers to just keep working and eat while she's busy rather than taking a break. And Olivia acknowledges that sometimes there's not enough planning on her part to bring a lunch.
Yeah. And it's normal. I think all of us have gone through this, that we skip lunch for many different reasons. But it does have some kind of an effect on our work quality and work interactions eventually. I mean, it's a basic need is food. So it's like, how can we be better at setting these boundaries where we protect some of our time, especially breaks and lunch? Another question: what are your ways of decompressing or de-stressing during your work day? So during the day itself, like, how do you decompress? How do you, de-stress during your work day? Like, so while you're at work, what sorts of things do you do? And I thought that these were conversations that can give ideas to some of the other, some of your other colleagues that are currently attending this presentation. Any answers, Dawn?
Yep. So folks are saying, I see more playing with kitty cats. So we have some kitty cat fans here like me, listening to music with headphones, getting up, walking around, looking out the window, actually sitting in the sun when it is out. Folks are saying listening to audiobooks while working when they can, and taking grounding and stretching breaks, talking, connecting with coworkers, moving on to something else, getting up, moving around, talk to the dogs. Hannah has a Zen room that has a massage chair.
Oh, that sounds amazing.
And it looks like Sarah Lynn and Hannah have access to massage chairs. So I think we need to talk to Rutgers about that. Because I would like one in my home. Let's see here. Even, taking a lap around the office when they get up to go to the bathroom, playing games on the phone, taking walks during breaks, or keeping a journal so we could get distracting ideas out of our heads. One of our attendees has a close sign. And
I love it.
Off the lobby lights from 12 to 1. That's excellent. Texting friends, background music. I do that as well. Playing games on the phone. Breaks to look at pictures of friends, family, loved ones, or just to stand outside. So great suggestions all.
Yeah. Excellent. And then the last one is, do you have a difficult time maintaining or establishing boundaries with colleagues? And right now, doesn't seem, there's only 20 people that answered some of these. So if there's more people that want to answer this, it's yes or a no. Seems like from the people that answered, less people have problems with establishing boundaries with colleagues. I know for me, I always want to say yes to everything. And then that can lead to burnout.
I concur. So most folks, so we have a couple people commenting, or a few people commenting that their boundaries are pretty good with their colleagues.
Okay. That's good to know.
It is good.
All right, let's finish this video and then we can move on to the rest of the presentation.
Oh, her reaction reminds me of that term when you're both hungry and angry.
You mean hangry? She definitely looked hangry.
Yeah, we've all been there. Sometimes things go awry at just the wrong time.
That's true. We have to respond to crises, but if we don't take time to plan ahead for our own self-care needs, it will eventually start to impact the quality of our work and our interactions.
It's definitely hard to help people recover when we ourselves aren't taking good care of our own needs.
Yeah, I like singing in my car on the way to work. It always puts me in a good mood.
Singing can definitely boost your mood. All right, let's check in on everyone one last time.
Hey, yeah. Oh, I'm just about to start my lunch break. I haven't eaten lunch for the last couple of days. Do you mind if I take my lunch and then I'd be happy to help you at 1:30? Hey, John, can you back up a little bit? Thanks, bud. I want to thank you for being so patient. I'm really sorry. I know you've been waiting all morning to use that TV. I just started my lunch. I can call Sarah and Amy and see if one of them could hook up the TV for you. If they can't, can you give me maybe 15, 20 more minutes so I can eat my lunch, and I'll be happy to help you.
Why don't we go through these one more time?
Okay. So again, we have 5 trauma-informed care universal precautions, which will help us provide the best quality of care to our clients and make life easier when dealing with colleagues. Number 1, consider and address pervasive crises. Number 2, use therapeutic communication. Number 3, no room for judgments. And number 4, create a healing environment. Derek, do you know what the last one is?
Practice self-care?
Correct.
You know, staff may not think that trauma and how we interact with clients is such a big deal, but sometimes when you listen to people who've experienced trauma, you can learn a lot from their stories. And that is super important to remember.
Yeah. Speaking of which, let's hear from the staff and clients one last time.
You know, there's more to me than just my mental health conditions. I wish staff would listen to me and work with me for my needs and wants and wishes for my life, instead of just telling me what to do and how to act.
Look, I've been through a lot in my life. I just wish they wouldn't shame me for acting out the way I do. I just want to feel safe, and they don't let me feel safe here. I feel like I'm being punished for having a diagnosis and not being respected.
I mean, this should be a collaboration for me to get better. And the staff should respect my input. Also, I feel like I'm being punished for being sick. And, you know, when they yell at me, I want to yell back.
You know, I get it. Everybody wants to feel safe, and we all need to collaborate more with the people that we serve in order for them to get better and to keep us safe. If the culture is going to change around here, I need to do my part, and we need to hold each other accountable.
Informed universal precautions. Remember these 5 so we can all thrive. Use therapeutic communication. No room for judgments on anyone. Create a healing environment. Consider and address pervasive crisis and practice self-care. Don't forget your self-care. Trauma-informed universal.
Okay, so those were the 5 universal precautions. Hopefully that song will help you remember them. questions or concerns regarding those universal precautions before we move on, because the time has just flown by. So Dawn, if you want to let me know if they have any questions about the universal precautions or anything else, and I'm going to try to fly through the rest of these slides.
Absolutely.
Okay. So we already touched on boundaries, like what boundaries sound like. I did want to talk about like what your boundaries are, but I kind of wanted to make sure that we touch on coping skills. So I'm going to skip over the slide since many of you are not really having a struggle with setting boundaries, but this boundary slide is available when we send out the slides. So here are some quick and immediate coping strategies. So I broke them into 3 categories: relaxing activities, physical activities, and support activities. So immediate ways to kind of cope in the moment. Breathing exercises are excellent to help calm our nervous system down. Getting fresh air is also excellent in helping to cope immediately. If you can get a break and just take a 5-minute fresh air break is great. Listening to music, a guided imagery, relaxation or meditation apps. I'm going to give you guys, I have a few handouts. I have one handout specifically on coping activities. I have another handout on a list of apps that have like guided imagery on them, meditation on them, breathing exercises, apps. So many different apps that can help you with those things. And then physical activities really help. If you can get outside and maybe like take a walk outside, that would be really helpful in the moment. Relaxation, like progressive relaxation and tapping exercises really help. Someone already mentioned yoga. One of my favorite things, just doing a few yoga poses can actually help. Like child's pose is really helpful. Putting your feet up the wall is also really helpful. Dancing it out for a few minutes can be helpful, or singing can be helpful if you have an area, maybe even go into your car if you're at work. If you're at home, then you could probably sing. I know many of you probably don't know this, but gum chewing could actually relieve stress. And then of course, like a support. So like calling a supportive friend or family member to vent is always helpful, or going to a colleague. And these are for coping strategies for at work or, even at home. Again, these coping strategies, they're designed specifically for, well, I'm talking in the context of helping providers, but these can also help your clients. So feel free to share them or share the handouts as well. Self-care precautions at work. Remember not to judge your own feelings. Feeling stressed out, anxious, scared, depressed, or overwhelmed are normal feelings given the crisis we're all facing right now. Identify your personal signs of burnout. I actually created a handout, a burnout handout, on like what are certain signs that you might be burning out. You can like look through the signs. There's a whole list of them, and have ideas as to what maybe your signs are. I think on the next slide, I put that list also. Schedule regular workday breaks and try to get fresh air. If you can't get outside, even just opening a window could help. Big one for me is ask supervisors to prioritize your assigned tasks. Have you ever gotten to work and you have like several emails and you already had like tasks from the day before? And so these tasks just keep getting added onto your schedule. And you're like, I don't even know where to start right now. What I've learned is sitting down, having my list of tasks and going to my supervisor and saying, okay, so these are all the things that, that look like they might be due today or due this week. Can we prioritize like which ones should be done immediately? which ones can wait till the end of the week, and then have a list of like 1, 2, 3, 4, 5, 6, and so on, so that you feel like you're a little bit more in control of like these tasks. So prioritizing assigned tasks with your supervisor is super helpful. And it's a self-care thing. Ask for help before you begin to feel overwhelmed. Lean on your coworkers for support and establish personal boundaries. What kinds of job responsibilities and or work conditions do you feel burn or stress you out? You can put it in the chat. I'm going to keep going, but feel free to put it in the chat. So what kinds of job responsibilities or work conditions do you feel burn or stress you out? And these are the signs and symptoms of burnout. I will be giving you a handout that has these signs and symptoms on the handout. And then there's like a place for you to write them out, or you can even check them off. It's like a check off list.
So Sarah Lynn is saying she had a supervisor who was rude and yelled at her. Monica's saying having too many meetings and trainings, too many clients' crises in one day.
Oh, that would be, yes.
Yes, definitely. Difficult. So putting fires out all over the place and never getting a chance to recoup.
And yeah, unsupportive colleagues would be huge, especially supervisors.
Yes.
So here are some work self-care ideas. Some we've already touched on, others maybe we haven't. Let's see. This is a good one. Check in on how you're feeling hourly in order to raise self-awareness and to adjust. We're not used to doing that, but like if, you check in on yourself, maybe at the top of the hour and say, okay, how am I feeling right now? And what can I do to like adjust so that I don't get burned out? What do I need? Like, is it a glass of water? Do I need a snack at this moment? Do I, do I need to talk to someone? But really to just check in, like, a minute check-in, 30-second check-in, just to see how you're doing. Monitoring yourself during the day. Creating a to-do list by prioritizing tasks. Yeah, that one I already talked about. A big one for me is organizing the files, especially on my computer. There's been a couple of times like I'm working on a few projects and I get to my computer and like the projects are all over my desktop and I feel overwhelmed. So organizing for me is a big one. Another one that I saw on people's desks, many colleagues' desks were like stress balls, any kind of sensory toys. One colleague had like a scalp massager on her desk and it was like one of these things that it was like a weird like gadget and like, what in the world is that? And she's like, oh, that's my scalp massager. I was like, really? That was interesting. And then I saw one in the mall in like one of those kiosks and got one. I was like, oh, wow, that really kind of feels good. So having like these things built into your day where you can easily access them and have these stress relief moments, even if it's only for a few minutes, can really help manage the day. It doesn't take the stress away, but it helps you to manage your day a little bit better. And I wanted to list a few self-care items you can bring to work with you. I mean, I don't know if every job will let you bring these things, but some jobs will. And the two that have a little click on, these are like breathing devices that were kind of cool that I thought I would share with you guys. And I will have handouts with lists of all these things on them. And then when we think of self-care, we always think of like bubble baths and facials and getting our nails done. But we don't think of like the practical self-care ideas. And part of self-care is really creating like routines, to-do lists, organizing, cleaning, avoiding things that can cause you unneeded stress, like social media, creating a social support network with people you trust, admire. Also, what I found helpful is like setting alerts on my phone for important things. So like if I need to take a break or need to take lunch and I know that like during that week I hadn't taken lunch in a couple of days, like I'll set an alert and say like lunchtime alert. Or if something important is happening, I always set an alert on my phone. I put it in my calendar and then I, set an alert. But yeah, so think of your practical self-care ideas that can be helpful to you and that can help you de-stress and decompress. And so these are the handouts. Hopefully they will be mailed to you. I have a trauma-informed universal precautions handout. So a list of all the universal precautions and all the little things that we talked about under each precaution you can share. Feel free to share with your colleagues, supervisors. There's a burnout assessment called the Professional Quality of Life Scale. And that one probably would be helpful for you guys. You can share it with your colleagues and supervisors. Personal sign and symptoms of burnout, a self-care assessment, there's self-care ideas worksheet, self-care apps, a sleep hygiene, technology fatigue tips for working from home. And then I have the link for the trauma-informed universal precautions if you want to share that with your colleagues as well. And then if you guys have any questions right now, I'm more than happy to answer questions. And then also, is there anything you wish were added to this presentation that would be helpful that was related to the presentation, of course? But this is the end of the presentation. I made it through.
Thank you, Giovanna. You did, and so well. I'm sorry you had to rush a little bit at the end, but that's what happens. The time gets away from us, and you're getting a lot of thanks in the chat pod. And yes, everybody, we will send out, Washington State will receive the PowerPoint slides that Giovanna presented from. Also embedded in that, or actually, I'm not sure. We'll probably send you a link to the video, right, Giovanna? Maybe we can.
Yeah.
Yes.
And you have my contact information. So if you want any of these handouts and they didn't give it to you, feel free to email me and I'm more than happy to give you those things. Let me see. If you take a picture of the slides, you can, I think our information is right here.
I think it's the first slide, maybe.
Yeah. Down here at the bottom are both of our email addresses. So if you just take a picture of it, feel free.
Right. And so the cloud recorded, link to the cloud recording, the PowerPoint presentation slides, and I believe a link to the trauma-informed care universal precautions video on YouTube will be sent to all of you. If there's anything like Giovanna said that you realize that maybe you saw during the training that you end up not receiving from Washington, please respond back to them, and they are great about reaching out to us about more, or like Giovanna said, feel free to reach out to us directly. We love to hear from all of you. So thank you all for being so participatory. And I just want to say, Giovanna, Monica said this is one of the best TIC presentations she has ever participated in. And Pamela, thank you as well. I appreciate those comments. You're all very kind, and we love working with the state of Washington because you're all so kind and so participatory. So thank you. Giovanna, you want to say anything else before we close?
No, I mean, if you have any questions, I'm more than happy to answer them right now. Yeah, no, this was great. I really enjoy this. And yeah, if you have any questions, feel free to reach out to me. I'm more than happy.
Thank you all. Have a wonderful rest of your day. I know it's just getting started for you. So be safe, be well, and have a great day.
Bye, everyone.